Good morning everyone and welcome to day 2 of Workplace Opportunity Week. Workplace Opportunity Week forms part of a wider campaign called Meet Your Future that offers young people across Greater Manchester the opportunity to meet with and have conversations with people from different sectors and industries. This morning we are joined by Dr. Pontiago from Ashcroft Medical in Oldham, and he will be talking us through information relating to the health and social care sector. Over to you, Dr. Pontiago.
Thank you very much, Jane. Good morning, everyone. I hope you're having a great day today. Jane, if you could move on, thank you. So Ashcroft Medical is a private medical clinic that was set up in 2015, and it delivers services to the Greater Manchester community. We are based in Oldham, and we're here today to give you a little bit of an insight into the careers that are available within the healthcare sector in general. And to do so, I've taken a very light approach for all of you today. We're going to talk about 3 things in particular. We talk about business, the clinical part, and what we call the crossover professions, those where we integrate business with clinical practice, and a little bit about the regulatory framework as well. Okay, Jane, if you could move us to the next slide, please. So let's start with the vision for the company, and this should give you a little bit of an insight of what the vision for many of the healthcare sector practices have in common and common values and so on. We are here to promote and deliver excellence in dental and medical care in a comprehensive and compassionate way that honours individuals and empowers people through open and honest communication and earns the loyalty of every patient we serve. You can see that this statement is very compact. There's a lot to it, but I think there's a clear message here, which is to honour individuals and empower people through open and honest communication. And it's about serving them, it's about caring for them. I'm not going to go through the mission in detail, but actually I'll skip straight into our values. We're here to promote safe, caring, inclusive, quality and effective and social values in healthcare, and we do this in a number of ways, and I'll go into more detail about this when I talk about the careers themselves. In general, these are statements that we make available to the public so that they have some trust in what we do and how we do it. Now we're regulated by the Care Quality Commission, and in so we have to maintain a certain level of governance and a certain level of transparency in everything we do. We are inspected at regular intervals by the CQC, and when the inspectors come, they look at all of these areas, the clinical, the crossover and the business areas, and they do so in a number of ways. This is like the methodology that they use. So they look at our complaints, if we've had any, our compliments from our patients, what are we doing that's innovative, that's good. They will look at health and safety and how we manage the health and safety in the clinic through risk assessments, through fire assessments. They'll look at the environment, whether it's tidy, whether it's safe to work in, whether it's pleasant, both for patients and for the staff. They will look at any previous inspections that they have done and any management visits that they will have conducted, if that is the case, and we have been audited 3 times and we deem to be good. They will look at how we manage ourselves, financial management, all our procedures, any guidelines that we have, codes of practice, and these are really crossover. They look at how we manage ourselves from a clinical perspective, but they also look at how we manage ourselves from a business perspective. Now they'll look at our service users through surveys, through meeting with our patients and gathering some feedback about them, see how things are going, how they feel about the service, how they're being treated. And finally, they'll look at the staff and whether the staff are happy, whether the staff are trained, whether the staff are meeting all the legal requirements in terms of having their own insurance, in terms of practicing the profession in the way that is prescribed by the different regulatory bodies, such as the GMC, which stands for General Medical Council, or the GDC, which stands for the General Dental Council. So this gives you a perspective of how effectively we ensure that society is being managed from the point of a healthcare delivery. So that means all the services that we provide are robust, are safe, are caring, and people feel comfortable about visiting their doctors and their nurses and having at least a good environment around them when they're not feeling so well. Jane, the next slide, please. So let's now start about talk about the careers themselves. Now, many people may think that a clinic like Ashcroft Medical only employs doctors and nurses and perhaps some support staff. Well, that's actually not true. There's a wide variety of careers, and I have taken 3 slides that I'm going to present to you showing the different areas where staff are engaged. And I've linked these areas to the dashboards that are actually used to run the clinic at every monthly meeting, so that you see this is a snapshot of reality in time. So we have colleagues who are responsible to market all our services, and we'll use digital marketing techniques. We'll use Facebook, LinkedIn, and you name it, all the new platforms, including TikTok. We then have a PR colleague who does all the public relations, and that is actually the colleague who has engaged in organizing this event for all of you. We do branding to make sure that our brand is appealing to the customers, to make sure that our brand is portraying our mission, our vision, our values. And so you can see here that this combination of professions ensures that we are out there, we are known, and we'll see what's going to happen next. So moving on to the dashboard, we look at all the patient statistics, and the patient statistics are looked at from the point of where somebody looks for us on the internet via Google and other places to the point of where the patient comes to us and leaves the surgery very happy for the treatment that they've had. We also look at the patient feedback, and the patient feedback is taken by colleagues on the ground, as well as looking out for any comments that are posted on the internet about us. We then look at all our staffing to make sure that our doctors and nurses are staffed for the appropriate needs of our patients. We look at equipment. We have equipment managers to make sure that all our equipment is running properly. That's from the x-rays to the dental chair to any office equipment that we may have, desks, chairs, and so on. And then we have a series of regulatory matters that we have to comply with. So regulatory matters which could include things like fire safety or the control of hazardous substances to the health. Jane, next slide, please. So that was a quick perspective over some of the business items that we look at. And in each one of those squares that you've seen, we have dedicated staff that perform those functions, even though it's not quite a quick, a similar match, but it's a very, very close match because some staff will take 2 or 3 different functions at the clinic. Now, from a clinical perspective, of course, we employ doctors and nurses. We have a team of about 45 people, including dentists, dental nurses, surgeons, gynecologists, GPs, phlebotomists, receptionists, and so on and so forth. Now, doctors and nurses look specifically at ensuring that there is complete control of any potential infections that may arise in the course of their business. So infection control is done by the nurses, and it covers all the clinical part of the services to ensure that the clinic is fit for purpose from the point of view of the health requirements. We look at managing medicines, ensuring that, for example, the issuing of prescriptions such as antibiotics is controlled, so that we know what prescriptions were issued by what doctors for what particular treatments and how they worked, and review all of that. We look at the medical notes. We'll review the medical notes. We make very comprehensive medical notes about every patient and every situation. That's obviously done by the doctor or a particular nurse. And then we monitor patients.
Doctor, you've muted.
Oh dear. How did that happen?
We're up to medicine management.
But I didn't mute myself. That's so sorry about that. I don't know what happened. So was I not muted before? Okay, so as I was saying, medicines management is done by colleagues who look at how we prescribe antibiotics and other medicines at the clinic, and then we look at completing the patient medical notes, ensuring that those notes are fit for purpose and describe the conditions that patients have. This is done by doctors, and then we look at all the monitoring part of patient care. That really is to say that we look at how the whole service has worked from entering the clinic to leaving the clinic, and staffing governance do that. Next slide, Jane, please. The crossover dashboards and the careers that come out of these are careers where we employ colleagues such as lawyers that look at policy and procedures that govern all aspects of the business. And that is to say, governing the CPD that the doctors have to complete, or the continuous professional development that they have to complete, all the way to how the clinic needs to be cleaned and the details of what goes with cleaning the cleaning. So just to give you a range of perspectives that are covered by policies and procedures. Then we'll look at health and safety, as I've given an example before. More generally, we also ensure that all the substances that are hazardous to the health are controlled, and we know exactly where they're positioned, the quantities that can be dispensed, and this is all controlled by staff that do that deal with these substances on a daily basis. So it could be nurses, or it could be specialist staff who just deal with this particular area of the management of Ashcroft Medical. We also ensure that all we do is safeguarded, and we have all our doctors and nurses trained in safeguarding, okay, ensuring that when you come through the clinic, if there are any signs of particular areas where we feel that safeguarding issues are at risk, then those are dealt with, whether it's in the clinical room or whether it's because they've been identified by any other member of staff. So if somebody comes very sad, we might ask, you know, are you okay? What's happened? We'll try and find more about it. Prevent is effectively preventing radicalization. All our staff are trained in that, and that's a wider scope. I'm not going to go into detail here for you. We also look at any incidents, accidents and near misses that may have occurred in the way we run our business. All incidents, accidents and near misses are actually reported, investigated, and improvements are made. Again, this is separate staff that do this, that work in governance, that will ensure that all the full premises and the services are run safely, and that if there is any incident or accident or near miss, that we investigate and improve on our services. And there's a suite of audits that we go through to ensure that we are compliant with the CQC regulations that I've mentioned earlier on. These audits will cover anything from the position of equipment in the room to how, for example, what's available on the desktop for all our doctors. It goes to this sort of level of detail, to where particular medicines are stored, to where the emergency box is kept, who's trained, and so on and so forth. So this, I'm hoping it's given you a full perspective of all the things that take place at a private medical clinic like Ashcroft Medical. So thank you very much for listening. I hope you enjoyed this short presentation.
Thank you so much for joining, everyone. We look forward to you joining in different sessions for the remainder of the week, and also Dr. Ponciano will be joining us on Friday as part of the Growth Sector Q&A panel. Have a lovely day and goodbye.